Hi, Tara here, doing my video report for my communication observation using the PaCT tool. I am an MA in a clinical dermatology setting. I usually get to see patients from start to finish with their visits, including when the provider is in the room, because I am charting the entire visit. So I get to see multiple visits every week. I also work with multiple providers, so I did make copies of my little PaCT guide and took them into multiple visits, hoping to catch something that really stood out between the different providers that I work with throughout the week. And there was one visit that really stood out, and so I decided to use that one. I was working with a provider that's a DO in our office, and I had a husband and wife come in, and the husband was the patient, and he was going to be treated for the day for precancers. This patient is someone who has come into our office every 6 to 8 weeks for probably at least the last 2 years. I know them very well. They usually see a different provider in our office, but his schedule was full, so this is the first time they are seeing the DO provider that I was working with for the day. So, from the start of the visit, when the provider enters the room, he immediately creates rapport with the patient and his wife because he's never met them before. So, positive there. He introduces himself. He asks both of them a little bit about themselves because he doesn't know them, and really just acknowledges that he is happy that he's seeing them for the day. So, into the visit, the patient clearly has more precancers that need to be treated. We usually treat them with liquid nitrogen and just spray them and they go away. But precancers have a chance to turn into a squamous cell skin cancer if not treated, which this patient has been seen for multiple squamous cell skin cancers. So the provider knows this because he did look at his chart notes from previous visits, and he had just had a treatment for a skin cancer about 4 weeks prior to seeing us for that day, and so he already knew what he was coming in for and kind of where he was going to go from there. So when I get to the demonstration of interest and empathy, that was the big part of this visit that made me choose this visit for my video report. So when he's in the middle of treating the patient's wife starts crying. And I've seen them many times. I've worked there for 5 years, so I know them very well. And I noticed that she's starting to get a little bit emotional. So I kind of try to make light of the situation and joke with her a little bit. And I can tell that as much as she's smiling, it's not working. And so she's trying to hide it, but it's not being hidden very well. So the provider notices that the wife is kind of trying to hide her face and she's doing this and she's like trying to wipe her face off. And he's like immediately acknowledges her emotions and and stops what he's doing and asks her if she's okay. Um, and she's just like, I'm fine. And he's like, okay. So he finishes the treatment with the patient and then sets down the liquid nitrogen canister, sits down on his stool, scoots up to both of them, and acknowledges the wife's emotions again. And he used part of the tool that when I was writing down my notes, that he wanted her to, even though she wasn't the patient, to expand on her expressions or feelings, or her expression of feelings or emotions. So he asked her why she's upset. And she goes on to let the provider know that she's just lost her husband 3 times. And by this, she meant that um, he's died and come back to life 3 times. 8 years ago, he had a diagnosis of lymphoma. And even though he's in remission, it was a very serious and emotional time for them. And I think for some reason today, after all the visits I've seen with them and she's been fine, for some reason today, it just hits her that he's in here once again getting treated for a different diagnosis, and I think it was just a little bit overwhelming. So the provider responds appropriately to her emotions. He maintains his composure. He not only has verbal cues of trying to get more out of her and let her express her emotions, but he also has nonverbal cues because he scoots his chair up to them, gets very intimate with them. Um, and then the last part of it is he almost like shows an active listening style where he repeats what she's upset about, but then goes on to let her know that what he's treating and what we're treating in our office for squamous cell skin cancers and all these precancers, that it's something that she needs to have a little bit of ease about, and not that she needs it, but he wants her to understand that these type of diagnoses are nuisances. They're not something that is life threatening. Um, Skin cancers he goes on to explain, like, skin cancers usually grow like rust, so bigger and deeper the longer you let them sit without treating them. But they're not something that goes unnoticed with how often you're in here, to where it could be a life threatening type of illness. So then he explains that she she has every right to be emotional, but it's not a lymphoma, and he just wants her to be at ease that it's something that is easily treatable. So not only does that ease her and kind of calm down her emotions, but it also eases the patient. So that's the biggest thing I noticed is, even though he wasn't showing emotion, you can tell by his nonverbal facial expressions that he is calm and comforted at the fact that his wife is more understanding and she's okay too. So um, it went on to making sure that he understands his treatments, that he understands his diagnosis, he understands why they're choosing the treatments that they're choosing, um, make sure that they're okay with the treatments that are happening. So he hits a whole bunch of points on my PaCT tool for, in a good way, for keeping the patient at ease and having them schedule follow-ups so that he can continue to see them, and make sure they understand everything before they leave. So all of these like confidence in what he's saying, all of these little points on my PaCT tool, he's hitting. The one thing that I noticed with this provider, and it wasn't just with this patient and his wife in general, in this visit per se, because he really did sit down and talk to them face to face. That's not normal for this provider. So, why I say this is a negative that I caught for multiple visits for the week. And I don't even want to say it was for this one, even though we're just supposed to have one visit that we talk about, because it really wasn't. Like, he hit every single point on this PaCT tool, and I was really, really impressed. But with other visits, his downfall and the negative that I get from his visits, watching them daily that I'm with him, is that he doesn't speak face to face with most of his patients when explaining treatment options. So I say this, and just a quick explanation would be: a patient comes in for acne, he gives them medication, he explains to his MA why he's treating him with that medication, why that is the best option for that medication, why he chose that medication. He does this with every visit, no matter what he's seeing the patient for. It's great for me because I'm in school to be a provider, and so to be a PA when I'm done. So I learn a lot from him, but not having that face to face, one on one type of communication and contact with his patients sometimes is a little bit of a deterrent, with his patients mm, feeling that he is really concerned about their well being because he is telling me what he's doing for them. So I don't know if it's just his mode of getting everything out because it's more of in a teaching style, or why he does it. He's been a provider for a really long time. He's a great provider. But it's, for some reason, he just doesn't look straight at the patient when he's explaining treatment options. So that's a negative I noticed with this provider. Fortunately for the patients in the scenario that I chose to observe, that didn't happen because there was emotion involved. So he immediately didn't do that and went straight for the patient and his wife to confront them face to face, to talk with them about anything they needed to talk about. So I can't say that there was any negatives in his visit, but in general, usually that's the one negative that I catch from him while looking through my PaCT tool and assessing all the visits I did with him in the entire week that I was kind of watching visits throughout my day. Other than that, this was really informative. So I really liked this assignment, and I'm not just saying that, like, it really made me watch a visit from start to finish. I've been an MA for 9 years, so some of these things I just kind of take for granted. And I noticed that it's just like my day-to-day life. So it's something that kind of goes unnoticed, but it really did open up a knowledge about communication styles in a provider patient setting that I kind of just had in the background at my job. So um, that is my video report. And if there's any questions, let me know. Thank you.